Hey there, it's Clara from AcuPro Academy, and today's Made Easy video is all about TCM Diagnosis, all on the inquiry method regarding the stomach and the intestine system. So specifically the stomach and the large intestine, mainly the digestive system, because those two in TCMs are so much related, right? Like the stomach is the beginning of digestion and the large intestine is the end of digestion. So they have a very much big relationship in TCM. And so I wanted to look at diarrhea versus constipation and stomach chi rebelling and acid reflux and all that fun stuff. If you want more, I have tons and tons of definitely awesome videos on my website, acuproacademy.com, PDFs, I have treatment protocols, and all on my resource page and blog. There's tons of TCM courses as well. So you're welcome to go on acuproacademy.com. I am Clara and I'm your host today on this next video. So without further ado, let's start the stomach and intestine system. By the way, I did the spleen already. The spleen is already on my YouTube channel. So you're welcome to watch that because it is still part of digestion or the digestive system in Chinese medicine, right? It's all about the digestive system, which is spleen and stomach are part of it, but so is the large intestine. So let's start with inquiring the right question where everything starts for the beginning of digestion, which is in the mouth. That's the beginning of digestion. So when there is, we're going to look at the taste first, right? So if you look at the 5-element, bitter taste usually is more heart-related in the 5-element, but it's also stomach. So bitter taste in the mouth connotates stomach or heart fire. A sweet taste means there's dampness, and usually that's affecting the spleen. No taste, that's the one at the bottom, is also a spleen qi deficiency. So when there's no taste or we lost the sense of taste, that's a spleen qi deficiency. A salty taste, salt, of course, related to kidney. So that's usually a kidney qi deficiency, but it could also be internal excess cold. And a sour taste, sour relates to liver. So in general, it's a liver heat or excess heat in the liver, but it could also be stomach because, again, stomach is starting in the mouth. So when it comes to mouth ulcers or canker sores, the heart fire will have canker sores on the tongue. The stomach fire will have canker sores on the oral cavity. So that's the difference. So when people say I have canker sores, you need to ask them in your diagnosis, are they in the mouth or on the tongue? Because that gives you a clue if it's heart or stomach. If the gums are sensitive, usually that's a spleen qi deficiency because spleen and stomach start at the mouth with the digestive system, specifically in the 5-element. They open into the mouth, right, and reflect on the lips. If there's bleeding gum, that's usually stomach fire. Okay, so those are two things you can ask question with patients. And if people have teeth that are loose or loose teeth, definitely a kidney qi deficiency because teeth are part of bone and bone is related to kidney. So those are a few questions you can start with your method of diagnosis when it comes to stomach. Stomach and TCM is really much related to the spleen, right? They're very opposite but very the same in that they work together. Spleen transform food and transport it for nutrients in the body, but stomach has to ripen and rot the food first so spleen can transform and transport it, right? So everything starts at the mouth with those two working together with the digestive system. But today it's specifically more on the stomach. So one of the most common pattern out there that I see in clinical practice is stomach fire. So which really is stomach qi rebelling. It's going up the opposite way of the right way for the stomach to go down. It's going back up, right? But it has also a lot of heat, a lot of fire. So heartburn or burning sensation in the stomach and the esophagus area, that is part of it, right? And then thirst with for cold drinks, and the person is gulping, that's excess pattern, right? When there's excess fire, the person is thirsty and they're gulping down. Mouth ulcers, because that's stomach fire again. Constant hunger. It's like you have a fire, you need to put food on it, and it keeps wanting more food and more food. Bleeding gums. Remember that heat and fire are very closely related. Fire means that there's bleeding. Heat, there's no bleeding, but they pretty much have the same symptom. So really, it could be stomach heat or stomach fire. If there is bleeding, then it's more stomach fire compared to stomach heat. Constipation, because of course everything dries up. Acid reflux coming up. For some people, it could be nausea and vomiting, and specifically sour regurgitation and sour vomiting and acid reflux, nausea kind of thing. Bad breath is also stomach heat or stomach fire. Like I said, heartburn as well. The pulse is full, rapid, because it's an excess. The tongue is red with a thick, yellow, dry coat. Okay, so that makes it a very big stomach fire. Specifically, the coat is in the center of the tongue. So as you can see, I put a bunch of points there that we can treat that specific with clearing heat and fire, like stomach 44, large intestine 11. Those are really good for that. When it comes to food, food is really good for the stomach to balance. Specifically, if there's a lot of fire, you want to try to basically put some cooling food, right? So parsley or parsley juice is one of the best things for stomach fire. Cucumber, celery juice, same thing, very good to bring the stomach fire down. Leafy greens, dandelions, seaweeds, they're all very cooling, right? Mint tea, very cooling as well. You can use apple cider vinegar. For some people that works. Not everybody works well with apple cider vinegar as well. So, but I would say that specifically parsley juice and celery juice are probably the best. And of course, avoiding spicy food and alcohol, because that's going to raise more heat, more fire. So let's look at differentiating the symptoms of the stomach when we look at stomach pattern. Cold invading the stomach. That's usually an external pathogen cold, so it's acute, sudden pain in the stomach region, cold body like shivering, vomiting clear fluid, cannot swallow cold drinks because of course they will vomit. So this is an invasion of cold. It could be a stomach flu, it could be, clear diarrhea as well as vomiting, but it's basically an acute issue. So the pulse is still floating and it's tense because it's cold, and we have a thick white coat on the tongue because again it's an excess and it's acute, right? So it's external, it's not quite internal yet. Stomach fire we just did, so I'm not going to repeat that. Very much we understood from the perspective of the slide before us. Food retention in the stomach. That is really indigestion. It's basically someone that overeats. So it could be acute or chronic. It could be acute if it's a Christmas dinner or a birthday dinner and someone overate and they're like, oh my gosh, I'm so bloated. I don't feel good. I feel nauseated, like I could vomit, and lots of sour regurgitation and really belching and not being able to sleep because our stomach doesn't feel right and we feel over full, right? So almost to the point where it's just so uncomfortable in the stomach region. But for some people, that could also be chronic. Some people overeat chronically every day, and that becomes a slippery pulse that's constantly slippery, full, large, big, because that's excess food retention in the stomach. And a thick coat on the tongue. Now, the color of the coat depends if there's heat or cold or not. So usually it's just a thick coat on the tongue, and most of the time probably greasy coat on the tongue for those people. So again, that could be acute or chronic. Stomach blood stasis. So stomach blood stasis is not fun. It's really, really painful. Remember, blood stasis is purple and pain. So pain in that region of the stomach is stabbing pain. That would be worse on pressure because that's an excess condition. When it's better on pressure on massage, that's a deficiency condition. When it's better on pressure or worse on pressure, it's an excess condition. So, or if the person put cold on it, it makes it worse because cold congeals and creates more stagnation. So pain is worse after meal. The person may be vomiting dark blood and there may be blood in the stool. As you can see, this is not a good condition. It could be bleeding ulcers. It could be a lot of issue, but it's usually not a great condition. It's quite advanced. The pulse is wiry, choppy, and of course purple in pain. So the tongue is purple with purple dots in the center. Stomach qi deficiency is very, very similar to spleen qi deficiency. They're very much related. Usually if there's stomach qi deficiency, there is an underlying spleen qi deficiency. So they both have no appetite. They both have a lack of taste in the mouth, no craving, very fatigued, especially in the morning, loose stools, feeling weak. And the only thing with stomach Qi deficiency is that the stomach region doesn't feel right. It's not painful, but it's uncomfortable. It's not right. People will say that very much often. The pulse is weak because it's a deficiency, and the tongue is pale, and it could be pink if it's not too much of a deficiency, because there's always degrees, right? Stomach yin deficiency. So stomach yin deficiency is quite a common pattern I see in clinical practice. So the person has no appetite, but they do eat. They just don't feel hungry. They have to eat because you have to. They usually like to sip on cold drinks all day long. So thirst, but for sipping cold drinks. They're bloated easily. They have constipation with dry pebble stools, like little pebble, marble stools, dry mouth, and kind of an achy stomach, like a dull stomach pain. It's not really painful, but it's just uncomfortable as well. The pulse is a yin deficiency pulse, which would mean it's thin and rapid. This person also may be tossing and turn at night and not sleeping well because they're hot at night. They have a tongue that's red, of course. It can be peeled in the center because that's the stomach area, and no coat. So as you can see, we're going into the deficiency mode, right? The first 4 patterns were excess, and the last 3 are deficiency. Stomach yang deficiency, again, very closely related to spleen yang deficiency. If there's stomach yang deficiency, you can definitely be sure that there is spleen yang deficiency underneath it or with it. So the pain in the stomach region is worse after bowel movement and better after eating or with massage. So that's a deficiency, right? So when someone is deficient, when we eat or we have a massage or a rub, it feels so much better, right? Specifically, if the person prefers warm food and they avoid cold food because it's going to make them worse, right? They have tendency to vomit clear fluid. They feel cold, specifically in the limbs, no thirst, and very fatigued because no fire, no heat, right? So the pulse is very deep, weak, and slow, specifically at the spleen and stomach region, which is on the right middle position. And a pale, swollen tongue. Swollen connotate the yang deficiency and the paleness because there's no fire. So those are all the pattern of the stomach. I went super fast, I know that, but it's just to kind of give you an idea. As you can see, a lot of similar symptoms, but some are very excess and some are more deficiency with fatigue and weakness, right? So we could see the difference. Now let's look at more of a large intestine picture. The large intestine is the organ that lets go. And sometimes we have chronic constipation and the organ is not letting go. And it could be due to diet, it could be due to no movement, it could be due to emotional stress, it could be due to a lot of different causes. But let's look at bowel movement itself and what it shows in diagnosis. So if someone has gas, a lot of gas, they're bloated, specifically bloated, worse by the end of the day. At the beginning of the day, they feel really flat stomach. And then as the day goes, they're sitting at their desk and suddenly their pants are getting too tight and too tight and too tight. And by the end of the day, the pants are bursting. There's gas, but there's also tendency to straining. So when they go to the bathroom, they have to strain and they have to sit there for a while. That is all liver qi stagnation. Okay? You can have food stagnation when there's lots of bloated gas, but mostly it's a liver qi stagnation in general. If there's liver overact on spleen, that means there's liver qi stagnation creating spleen qi deficiency, right? Liver overact on spleen is a 5-element pattern, and liver qi stagnation creating spleen qi deficiency is a zhongfu organ pattern of diagnosis in TCM. So IBS, or irritable bowel syndrome, sometimes nowadays it's called irritable bowel disease or disorder, is literally stress, which creates liver qi stagnation. And it's creating alternating constipation and diarrhea. So it depletes the spleen. So stress making the digestive system being weak. That's what it means. Sticky stools is phlegm. So when there is constipation, there is usually no dampness. It can happen sometimes with yang deficiency constipation, but it's pretty rare. So in general, with constipation, you know the difference. If you have a stool that is formed but very sticky, where the person needs a lot of toilet paper to clean after, that means there's phlegm. Okay, it's sticky. So that's a phlegm issue. Large intestine heat, basically this is a bowel movement that is large, formed, The person has to push and it makes them sweat and hot, but they feel better after the bowel movement. And it is very smelly. So no roses in there. You come back in the bathroom and you're like, whoa, right? Big bad smell. That's the large intestine heat. And the last two we haven't talked about, the blood or yin deficiency. So blood is kind of part of body fluid. So when there's blood deficiency, there's less body fluid. And yin is more body fluid as well. So in general, when there's small, hard, dry little pebbles or sheet pebbles or marbles, that's either a blood or a yin deficiency. Okay, and how would you know? Well, if it was a blood deficiency, the person would be pale tongue, right? But if it was a yin deficiency, they would have a red tongue and they would have feeling hot at night and red cheeks, right? That's how you differentiate. And the last one is pain, that is stabbing pain. Usually that's blood stagnation, so blood stasis with internal cold. So that could be acute or that could be chronic. So it's really fun to differentiate those different kind of, when we ask questions to people, and I usually am in clinic and I go, how's your bowel movement? You have one every day, right? So constipation is the person doesn't have one every day, or it is that they have issue like straining. They go, but they don't finish. An unfinished feeling of bowel movement is also a liver qi stagnation. So liver qi stagnation is gas, bloating, straining, and unfinished bowel movement. So there's a lot for people that don't move. Let's start moving. Then we can ask question on the opposite hand where it's more diarrhea, right? So when it comes to diarrhea, as you can see, we have lots of different kinds. So again, we need to differentiate if someone says, oh, I have diarrhea or chronic diarrhea, right? So I'm going to start with the top one on the fluid accumulation in the large intestine on the left-hand side. So usually if there's excess fluid accumulation or excess body fluid or dampness in the large intestine, the bowel movement's going to be watery, but with foams, like frothy, almost foamy, right? That usually is excess dampness in the large intestine or body fluid accumulation. Spleen qi deficiency is going to be having mucus. So different from the frothy, this one is more mucus-like when you have diarrhea. And it's very much loose stools as well with spleen qi deficiency, right? Often. But with diarrhea itself, we'll have mucus. So that can happen in people with colitis or Crohn's disease, for example. Food stagnation. Usually it's people that have that, overeating. And then eventually when they have diarrhea, it's very smelly because it creates heat, the food stagnation, because it basically, fester in there for a long time. Then it comes out and it's diarrhea that is very smelly with food in the stools. So pieces of food in the stool. So it went right through the person and it wasn't digested. Liver overact on spleen is the same as the one for constipation. It's liver qi stagnation creating spleen qi deficiency, or stress creating some urgency into going to the bathroom. And in this instance, it's diarrhea. Sometimes it can turn into constipation back and forth, and that could be IBS. But this one would be painful, urgent diarrhea, which is usually due to stress. Blood stasis is usually very painful. The diarrhea is very painful when the person is having a bowel movement. So the cramping very badly in the lower abdominal region. Urgent and smelly is usually damp heat. Okay, so urgent and smelly is really, smelly is the heat, and urgent is the excess damp heat. Of course, there's damp in every diarrhea because diarrhea is damp in itself, right? Liver overact on spleen is urgent, but it's not smelly unless there's heat coming from another place, right? So from the stomach or the liver. Cold damp is usually urgent. Again, this is more acute sometimes, but it's better with warmth, right? So, and it's very watery. So it would be definitely watery, urgent diarrhea, no smell. When it's cold, there's no smell. Heat is smell, cold is no smell. And the person prefers warmth. And the last one is spleen and kidney yang deficiency for early morning diarrhea. So we call this often in TCM the 5 a.m. diarrhea, or when the person wakes up, they go to the bathroom first thing in the morning and they have watery diarrhea, and they feel really cold in general and very weak and fatigued after the bowel movement. They're exhausted. And that usually happens once a day and they're good for the rest of the time, most of the time. So that's a spleen and kidney yang deficiency, not able to digest the food. So there will be also undigested food in the stools in that spleen and kidney yang deficiency pattern. Lots of information on this video, right? But this is how we differentiate the inquiry method of diagnosis when we look at diarrhea, because no diarrhea is created equal, no constipation is created equal. So let's look at the pattern of the large intestine. There are a few, not as many as the stomach, but there still are a few. So as I said, the heat in the large intestine is going to be more constipation with a burning sensation in the mouth because it's related to the stomach. There's usually stomach heat when there's large intestine heat. Dry mouth, dry tongue, a burning and swollen anus, maybe some hemorrhoids in there, scanty dark urine. The person is also going to have a smelly bowel movement, and when it comes out, it's formed, it's full, and it's a large amount, but it's smelly. The pulse is full and rapid because it's an excess pattern, and of course there's a thick yellow coat because that's excess heat at the root of the tongue because the large intestine is at the back of the tongue. So that's the opposite. Damp heat in large intestine is still heat, but this time it's not constipation, it's diarrhea, right? So it's watery diarrhea with abdominal pain. There may be blood in the stool or mucus, burning anus again because there's heat, strong odor, so the stool is still smelly because there's heat. If it's acute, like a stomach flu or something, there'll be fever and sweating. If it's not acute, you still can have heavy limbs, thirst with no desire to drink. So no desire to drink but feel thirsty. If you've never had that, people have a hard time understanding this concept. What it is your mouth is dry, but you just don't feel like drinking. It just doesn't make you feel like you want to drink, right? So that's what thirst without desire to drink means. And then scanty dark urine because, again, there's heat, right? So the pulse is slippery, that's the dampness, and rapid, which is the heat. And of course, it's a red tongue. There's excess heat with a yellow, sticky or greasy coat. The greasy, sticky is dampness, and the yellow is heat. And again, at the root of the tongue or the back of the tongue. Large intestine blood stasis. This is a bit bad one too. So this is usually constipation with stabbing pain. The person is really, really distended abdomen and the pain is so bad and it's worse with pressure. So they don't want to be touched. They feel like there's burning sensation in the anal area. They may have tidal fever, vomiting, and delirium. This could be a blockage, like this could be a physical blockage of the large intestine, and that's why the person maybe vomits. So this is a serious condition usually, and the person may have had no bowel movement for like 7 days. I've had patients coming to the clinic and they're like, oh, I go to the bathroom like once a week. I had a person saying, oh, I go about 2 to 3 times a month. And I was like, oh my, 2 to 3 times a month. Okay, we need to talk because that cannot be, right? You understand that this is not good. But some people are so used to it, they don't know the difference, right? So this would be a full, deep, big pulse. Because again, this is a serious condition. And the tongue is going to be red-purple because there's massive inflammation there because nothing is moving, which means the body is going to start reabsorbing all the toxins instead of evacuating them. So that's not good. I wanted to share with you on my website, on the resource page of my website, I do, if you go on it, have different kind of treatment protocol. And one of them is all on constipation. And it's my personal story with constipation due to emotional trauma. And so that kind of, you can look at it and I share that story with you. Go check it out on my resource page, like I said, and you look at treatment protocols, go under constipation, and you'll see I tell my personal story on this. And hopefully you can kind of see how emotional trauma can create chronic constipation for people, and because they can't let go of the emotional stress. Cold in the large intestine, that's usually going to connotate some diarrhea with sudden, this is again an acute. Like cold in the stomach we talked about before, cold in the large intestine is diarrhea with sudden abdominal pain. So this is more of an acute problem. It's cold feeling in the abdominal region. The person puts the warm or heating pad on it and it feels a bit better. It is urgency in the diarrhea and it's sudden and crampy. So this is, the pulse is going to be wiry, slow because it's tight and maybe deep if there's a lot. So again, this is acute most of the time. And the person will have a thick white coat specifically at the root or the back of the tongue. Dryness in the large intestine. So that's quite, you can see all those patterns we've seen so far. It's all excess, right? All the first 5 patterns, excess, excess, excess. Excess dryness in the large intestine is basically dry stool, difficulty in passing the stool because they're so dry, right? And they're coming out and really, really dry, so it can be painful and it could create some hemorrhoids or bleeding or fissures. Dry mouth, dry skin, thin body. The person has a thin pulse and a dry tongue cracked with no coat. So that needs a lot of lubrication and hydration, right? And the only one that I look at that's deficiency is large intestine yang deficiency. So that's not a common one, but the main symptom is loose stools as duck dropping. So it looks like, I'm sorry to say this to you if you like that, but it looks like yogurt consistency. I'm sorry to use yogurt, but yogurt consistency stools, and it is really yellowish in color. So very soft, very yellowish, but not diarrhea-like, right? And with a dull, achy abdominal pain. The person has borborygmi, which means they have sound in the abdominal region, like that watery sound, borborygmi. Pale urine, long stream of urine, cold limbs, cold body, fatigue because they have no fire, they're exhausted. And after the bowel movement, they're usually feeling fatigue as well. So they have a deep, thin, probably slow pulse. It depends on how much yang deficiency there is, and a pale, swollen tongue. So again, that's a yang deficiency. So as you can see, we have a lot of questions we can ask when it comes to large intestine and stomach pattern, even though in TCM perspective, they don't have a lot of function as much as the spleen does. They have a lot of symptoms associated with different pattern and treatment. So I hope that really, really resonated with you. I have tons more on my website. Please, if you want more, go there. Sign up to my newsletter. You get tons of free stuff all the time. So I have free courses, TCM courses on my website as well. And check me out on Facebook. I'm there all the time, every night, 6 p.m. Pacific Standard Time. I put new posts every single night. I create graphics. And then I would love for you to click the button on the YouTube channel and subscribe as well. That the more you show me you enjoy this, the more I know people are resonating and I can create some more. I hope you have a fantastic day. Keep rocking it using TCM. I'm Clara from AcuProAcademy.com, and I'll see you in the next video.